In order to prepare for this, we have already stockpiled in our state antiviral medications, and what's more, we hear that we heard over the weekend that the national stockpile, a portion of that, is being approved to be kind of forward deployed, if you will, as one might forward deploy assets in a hurricane. And in addition to that, we've been in touch with people in the private sector to make sure that there's no sort of unexpected shortage and that those things are available to people. But what individuals should do is make sure you take every precaution to, number one, make sure you wash your hands, make sure or keep that hand sanitizer nearby. The way that this is spread is through human contact, particularly the doctors behind me tell me, through hand-to-hand contacts.
Swine flu is a virus that causes influenza, a respiratory infection. And the signs and symptoms of influenza, including swine flu influenza infection, are fever and cough or sore throat. There can also be other signs, muscle aches, sometimes diarrhea or vomiting, but it's primarily fever and cough or sore throat.
Local health departments around the state are alert. They are aware of the situation, as are the physician community and the hospital community, to the developing situation. There are a couple of things that I'd like to repeat, one of which is the plan, the pandemic flu plan, which has been developed, it has been exercised and drilled, and it is a plan that is available on the department's website. This is our document that will lead us, if we need to, into further steps with regard to protecting the population in Maryland. Secondly, I'd like to again reference the very strong public health system that we have in Maryland. That's certainly the local health departments, but also, as the governor has indicated, here in Maryland we have a biosurveillance system that gives us near real-time evidence of what is going on in hospital emergency departments across the state. We have been monitoring that on a daily basis with regard to the population coming in with influenza-type illnesses, as well as over-the-counter medication sales. At this point, we are not seeing a significant increase, and again, as you know, we do not have any confirmed or probable cases of swine flu in Maryland at this point. Nevertheless, we are working very closely with the physician community, as well as our laboratory, which is undertaking investigations as we speak. One of those non-traditional data sources is to monitor the purchases around the state in pharmacies. So this would be over-the-counter retail purchases for a variety of illnesses, and in this particular case, we're watching for an increase in respiratory medications. I'll say that this is a national system that Governor O'Malley has pushed forward around the state. So at this point, we have at least 70% of the state's population is being monitored through this system. It is completely confidential. There are certainly no names attached to who's buying medications, for example. But it's relevant because not only is this happening in Maryland, but we are now tying the kinds of data that we see either through retail sales or through emergency rooms to what is going on in other states, including some of those states where there are reported cases.
So there's a number of different things that are, I mean, in addition to the over-the-counter pharmaceuticals and the symptoms presented at emergency rooms, we also track the symptoms that paramedics encounter when they're out there picking patients up. I know that in some areas we also look at the absenteeism rate in the schools and dead animal carcasses and the like, and you know, it's a bunch of different streams. And back when I served with Dr. Bielenson here in the city, it was also very good at picking up sales of Robitussin at your local CVS or at the Rite Aid.
Have there been lab tests that have been sent to the state lab for testing? Yes, but to date there have been no positive test results.
Any idea how many tests?
How many tests? A handful. A handful that we've received that are negative. I think there are a few that are pending at the moment.